much for coming. This is the Chicago Integrative Eczema Center. This is the July meeting, and I'm so happy everybody has joined us. I will be recording this as you see, and then this will be posted immediately after. It takes a little time for it just to get uploaded online, but I'll put the link on our website, chicagoeczema.com. And I try to have one of these at least every 2 months with some incredible folks to come and talk to us so we can continue the discussion and continue learning. Today, I'm very, very honored and excited to have Dr. Lisa Lombard here today to talk to us about hypnotherapy and beyond. And Lisa, I'm going to turn it over to you.
Thank you. And thank you for the warm welcome and making sure that you bring emotional and mental health and wellness into this conversation. And what some of the folks who've already indicated, you just are a star in the field. Everyone loves you. And so I'm really honored to be part of your crew here too, of who you asked to come talk to folks. So thank you. Yes, I'm a psychologist. I'm Chicago based, but I also provide telehealth services around the country now that virtual telehealth services and the SIPAC authorization has moved forward. So I do see folks across the country, but in person in Chicago is also available. And I'm a psychologist. I've worked for many, many years helping people with pain management and learning some stress management skills and how to better cope with anxiety. And about 10 years ago, I really started specializing in working with individuals, children through adults who had atopic diseases. So food allergy, eczema, and some autoimmune syndromes and diseases. And there's not a whole lot of overlap yet. I see it increasing, but it hasn't been well understood how there is overlap and intersection between psychology and concerns related to eczema. So I have been diving into it and learning a lot about it and working with people and adapting some of the skills that I'm very familiar with in the hypnotherapy and mindfulness world for those of you, patients and families caring for others who have eczema. And I'm even starting now to really make some um, adaptations of well-known procedures for pain management related to using self-administered self-injections. So there are a lot of biologics and new treatments which are now requiring at-home injections. And so it's a perfect fit, and we'll talk about that a bit later too. I do have slides, so if I can, am I able to share the screen? And I would show a couple of slides.
You should be
And
able to, yes.
okay, thank you. Uh, Easier said than done, of course. Here we go. And great. Okay. So, that first, well, you hear a lot about the mind-body connection, but I don't feel that enough attention and specificity is being given to saying mind, body, skin. So I'm now starting to say that more and more because it's, we are all whole individuals. And I know that in some areas like GI areas, mind, body is becoming more and more well understood, and it's a gold standard to use cognitive hypnotherapy actually for some GI concerns. And I would love to see that progress made related to skin disorders as well. I also like to point out, especially to those who might be new to thinking about it this way, that of course, when your eczema flares up and seems like it's coincidentally right before a big presentation or tax time or your child's going off to college or whatever it is, there's likely to be an intersection there between the stress you're experiencing and how your body is coping with it and inflammation. So if the immune system and inflammation are so exquisitely connected that I want to make sure that we recognize and respect that in some ways. Because atopic dermatitis, eczema, they really are stress mediated. And so when we can learn ways to manage stress, to reduce stress. One of the byproducts of that is turning down the immune system so that it's not quite so sensitive and reactive to what life is throwing at us. I also want to point out, and I think it's already been maybe implicitly discussed here, mentioned that this can be really, really difficult, and not everyone is as compassionate about it. And I think it does take some compassion and empathy for people who are experiencing chronic eczema. The one thing I also like to talk about is just how closely aligned in the common sense and language we are to understanding this. And now we're getting to the point of recognizing it in terms of treatment. But we have all sorts of little phrases, right, that show us that our skin really does, in some ways, mirror or reflect, or as a window even to our emotional well-being and to the stress levels that we have. So some are positive, some are negative, but we talk about things like, that person rubbed me the wrong way or got under my skin, or I'm itching to go do that, or I could have jumped out of my skin when that happened, or so and so is um, I've got skin in the game, right? We talk, or no skin off my back. And someone at a talk recently added some. So if you have others, you can put them in the chat. I would love to be able to update this slide to really emphasize how connected and kind of an implicit understanding that we have that skin and stress and the mind are connected. It's the same language. It's a kind of a bi-directional street, a two-way street between the brain and our skin. And so when there is psychosocial stress, it changes the ability of the skin to actually respond to environmental challenges. And that can further degrade the skin or interrupt some processes. And so then there's worsening of symptoms or the addition of new problems. And I like to talk about the same language that those two big body groups are working on. It's both anatomical and functional, that connection between the skin and the brain. So we know, though, we all have some wear and tear in our life, right? When stress is out there, when things are happening, it can get tough and we get worn down. And then we really have to turn our attention and deliberately rebuild in ways that promote resilience. So that's what I like to emphasize. And we're going to a mental health provider, psychologist, or someone else in the field can help with rebuilding so that you get closer and closer to that resilience. And we do it in a few ways. So you can work toward reducing the external load, right? How do you schedule your time? How do you make things simpler for yourself so that there's not so much impinging on you and pressing down? And another way is to boost your existing internal resources. So things ranging from good nutrition, good sleep hygiene, and getting enough rest and sleep so that healing can take place. Exercise and movement so that your body is working at its best. You're rebuilding the existing structure. And stress management skills like hypnotherapy and mindfulness are some of those tools to help with rebuilding or boosting what you already have in terms of your coping skills. So, we're talking again, just to recap, that there's this mind-body cycle and there's a weakened skin barrier, but it's also that there's some weakened building blocks in terms of your coping skills. And an accompanying concern is itch. So I'm putting that in there because I know that that's something that is a very distressing period of time when the itch is really strong. And hypnotherapy to some degree is a great tool. And I would love to have a conversation with us among us to talk about where it might serve you better even. Um, I'm just going to go through it real fast. So this is, that cycle really in a visual form, and it is a cycle. And wherever you start, other parts of it are going to get increased. So stress, I want to talk a little bit about what does that mean. It doesn't look the same for everyone, obviously, but in terms of the definition of stress, it's really considered to be when an internal or external challenge is greater than your internal or external resources. So that's an equation. Sometimes stress is a little bit good, right? We want to have some challenges that make us reach, that stretch, that allow us to get into the zone or a flow moment. But when the challenges are so great that our own resources are not enough, we feel stress. And then consequently, we can have either an acute situation of stress or chronic stress. And acute stress really is something that might turn on that fight, flight, freeze response, and we deal with the problem, and it's done. But chronic stress is a long-term condition, and what it does is it really disrupts our ability to adapt to additional new stressors. So it's like, as if you're going into a situation sort of handicapped when you have chronic stress, and you don't have as much time or energy for recovery, for regeneration, for responding to the stress. If you think about when you're stressed and then something else comes along and you make some, what we might call rookie mistakes when you're doing something. Stress really can interfere with our ability to make good decisions and reach into our cognitive insight. And instead we make some poor choices. We're just not able to be flexible and to adapt as well. And so the other thing is that the skin and the symptoms that we're showing are also going to be impacted by chronic stress. I'm trying to get rid of this, sorry. So what we're talking about is how chronic stress alters the immune system and our response to further stress. Is this thing in front of the slide? I'm sorry, there we go.
Ours looks fine. Yeah, your slides are coming through clear. Yeah.
Oh, okay, good. Thank you. I apologize. So long-term effects of stress on health, it really touches almost all, as far as I understand it, the systems of the body. There can be GI issues, so stomach and intestines. It can be cardiovascular and blood flow and the nervous system, the fight or flight that I mentioned, diabetes in the liver, and of course, headaches and migraines and things like that. And so we know that chronic stress is impacting so much of us. And now we're talking about chronic stress and the skin. So interestingly, right, the skin is not depicted or noted on this slide. That's an omission. That would be great to clean up. So having talked about stress and that we can reduce it by decreasing challenges and increasing resources, that's sort of our go-to equation of what we're up to when we introduce new behaviors and activities. So these things on this slide are some ways to reduce the stress of external challenges and increase our internal resources. As I mentioned, getting enough sleep, seeking out social support. We are now more and more aware of just how important a sense of connection and community is. It really does mitigate the impact of stress. And we've been learning that isolation and loneliness in 2024 are significant mental health concerns. And so social support is quite important. Learning to relax, and by that I mean really turning on the relaxation response. We have only one set of bones and muscles, and they can't be tense and relaxed at the same time. So when you learn through practice how to turn on the relaxation response, you really are enhancing your coping skills and managing stress, because something like progressive muscle relaxation, hypnotherapy, mindfulness, we're going to go through a number of these options, take up all the space, right? You can't be tense and stressed at the same time that you're relaxed. Getting exercise and movement doesn't have to be formal exercise. It's, as we all are increasingly aware, making sure that every hour we're up and about for a period of time. Could be while you're washing the dishes, right? To dance to some music, whatever it is, but it can't be emphasized enough how helpful movement and exercise is for managing stress and for decreasing anxiety. It is actually quite a naturally occurring treatment for anxiety. Some people really appreciate running for that reason, for example. Talking about what's going on, clearly talking about it, putting it into language, and knowing someone else is supportive is very helpful. Finding a hobby, doing something that you can immerse yourself in. In some ways, it's a great distraction. It's a way to place the stress and the difficulties out there externally. Asking for help. Some people have a challenge asking for help and feeling vulnerable, and yet it really is something that helps you stay connected with others. Eating well, as I've said, these practices of self-care, like paced breathing, mindfulness, guided imagery, and self-hypnosis, which are the areas that I do a lot of clinical work in and teaching, are really effective for a variety of conditions where there's pain, anxiety, and stress. Yoga, listening to music or playing music, right, has such value. Being out in nature, and we talk about nature bathing now, it's very important and is shown to be a nice way to reduce stress, to lower your heart rate, to improve your balance. There's even been research that just simply looking at a photograph or poster of a forest or nature when you're sitting in an office space can lower your heart rate. Volunteering and helping others is a great way to get outside of your own head and do something that helps with stress management, as does learning something new and becoming absorbed in it. If you're particularly interested in the current status of the science of hypnosis, here is a reference to something that came out April of 2024 in the American Psychological Association publication called The Monitor. And it really shows the areas of pain management and in terms of that hypnosis is useful for, and the why of hypnosis being effective, how it changes some of the patterns of the brain waves during hypnotic or trance states, and what portions of the brain, using functional MRIs and some other tests, are clearly showing that there is a change that's going on when hypnosis is used. And I use the word change a lot because I also like to emphasize that some of the stress management techniques, in particular mindfulness, I often get asked, what's the difference between mindfulness and hypnosis? And they're kind of first cousins. They're very similar, but there is one significant change that I like to emphasize, or difference that I emphasize, which is change. Hypnosis is an experience of being highly absorbed in an imaginative moment, set of images. It often comes with relaxation, but not always. But what's significant about using hypnosis, either with a therapist or as a tool that you use, and we call that self-hypnosis, is that you're suggesting changes in your own behavior or thought patterns or feelings. And so, unlike mindfulness, where you're growing your capacity to be fully present in the here and now, that doesn't have that same quality and element of I'm about to change something, or I have a goal where I want to change something. Mindfulness, you're really growing a skill set of how you focus your attention and in some ways extend it. And we know that that's really useful for managing some challenges, but there's no element of change that is special or tailored to you in that mindfulness experience. So how does hypnosis help? As you've already heard me say in a variety of ways, it's a great stress management tool. And it helps you increase those internal resources that we've been talking about and decrease the external challenges. So it's a beautiful natural fit for managing stress. some types of hypnotic experiences that you may already be familiar with and kind of make it seem more of an everyday experience rather than something that only a specialist would be doing. When you're watching TV or playing video games and become really absorbed in it and you don't notice the passage of time, that's a hypnotic type of experience. When you're playing sports, or if you're very athletic, or if you're competitive, or we're about to have the Olympics start. And I love that because often the camera zooms in on the athletes and their faces, and they are just so entranced. There's not a better word for describing how they look when they're about to run a race or to ski downhill or whatever whatever it is. They're in the zone, and that's a form of hypnosis. Routine daydreaming, um, a child who falls and gets a quote unquote boo-boo and turns around and runs back to the parent, and the parent either kisses it or pats it and says, all better, and the child walks away feeling great. Well, that's a bit of a hypnotic experience because there's been that suggestion that the parent has given non-verbally that you're going to be okay, and that the pain or discomfort that you did feel when you fell down can be reinterpreted and changed. And so that's a hypnotic type of experience. There's also the experience of what's actually called a negative trance of having a medical emergency when people need to go to the hospital suddenly, when they're very fearful or about to have a procedure done in the office. They may become also entranced. Their attention becomes highly focused on what's about to happen or on how that particular part of their body feels, or even on sounds and smells that they might be observing and noticing in their environment around them. And they're very suggestible at that point. And so we all have to be careful and thoughtful about the suggestion should be for comfort, not for additional pain. That's where the precision of language becomes really important in some of those hypnotic experiences. And then another common one is highway hypnosis. You get in the car and you drive home from work every day, and you're certainly awake and alert and doing all the things that you need to do, stopping and starting and turning on your turn signal, and you pull in and you don't really remember the drive because your mind has been elsewhere, right? You're thinking about your evening, who's going to make dinner, do I have to go pick up the kids, groceries, whatever it is. And that's considered a hypnotic experience, that driving highway hypnosis. All of those things have in common imaginative involvement. And I emphasize that that's really the signature quality of hypnosis. But there are other tools besides hypnosis, and I want to make sure that I mention and describe a bit about those. And those tools include guided imagery. So guided imagery is also very similar to hypnosis, but it's really with a set context and visual set of pictures that are described by the hypnotherapist or the person doing the hypnosis. So it might be a beach vacation, or it might be a trip up into the woods, or it might be playing with your grandchild, but it's suggested to you, whereas hypnosis uh, encourages and invites you to create and develop your own set of images and places where you feel especially comfortable. And so really jumping to self-hypnosis, it's how to use your imagination to perhaps in your own mind's eye visit a very special place where you felt comfortable and safe and at peace. And that's more of the hypnotic experience because you're creating it. As I mentioned, mindfulness is about being fully present in the here and now. And we'll do a little mindfulness-based experience in a few minutes. There's yoga, there's music, there's nature, and there are lots of other activities, which I'm sure you can add to this list. I'm going to skip past that and talk about the value of hypnosis is really, when we're talking about eczema and other skin disorders, is to help modulate that psychophysiological reactivity, to feel more comfortable to turn down some of those sensations or to alter the sensation. So rather than it be itching or pain, it might be considered that you feel some sensation, a lighter touch or a pleasant sensation of a breeze, so that it can reframe the input that your brain is getting. Modulating psychophysiological reactivity is, as I was just saying, so it's dampening the response or lowering it. It's using relaxation to counter the sensation. It could also be raising your sensory threshold. So, yes, there may be dryness, or there might be tautness, or there might be itch, but what can be suggested and grown through the use of clinical hypnosis is a person's threshold, so they won't be so bothered by it anymore. They won't notice it as much anymore, and they'll become more and more engaged and engrossed in reading their book or doing the hobby or running outside or whatever it is, and they don't notice. So that's how you raise a threshold. There are also suggestions for calming specific internal organs. And that's where when I was talking about using hypnosis for irritable bowel disorder, IBD, IBS, and GI issues generally, it's really about calming the GI tract. And so some of those techniques can potentially be transferred to working to calm the skin. And we just need to practice more and more creating those protocols, in my opinion. Hypnosis is good for self-soothing, especially when there's anxiety that might be associated with flare-ups, to reframe the panic episode. And by that, I emphasize, some of what's happening is that your body is working just right, but it's kind of working overtime. So it's behaving as if there are all of these threats, and the immune system needs to be on high alert, but it really doesn't anymore. And so as the skin gets healthier and healthier, the panic about future flare-ups or current exacerbations can be mitigated a bit using the hypnosis, and just a general somatic reduction is the goal. I'm going to skip that. These and you'll be able to get the slides if they're included in the handout or link. But what's really fun, I think, about hypnosis and working with people who have eczema, from my point of view, is that consistently I hear and understand, as I've learned more about this, that the analgesia that is very beneficial and that suggestions can produce can really be closely tied to feel a sense of coolness, right? All the things that help your skin feel better when it's feeling cool, when it's feeling moist, when it's not dry. Those are sensations that can be suggested during hypnosis and amplified during hypnosis so that there's relief. And some of the relief takes place during the hypnotic experience, and then some of the relief continues on after the hypnotic experience is over. But the suggestion has been adopted essentially by your mind, and you're practicing over and over again every day the hypnotic experience. So that self-hypnotic experience, that's where the fun part actually is of whatever it is that makes you feel better. We can use that as the core and fundamental basis for building suggestions together that continue on the relief. And the fancy word for that, so it's called a post-hypnotic suggestion, because you want the benefit and the relief and the suggestion to last afterwards. And so here's a couple of ways in the next two slides. You might either say it to yourself or hear your therapist saying it. When you breathe slowly and evenly like this at home, your imagination will be able to easily find the switch in the control room of your mind to lower the discomfort, or to find relief from that itching, or to not be so fearful, whatever it is that the person is struggling to manage. Another kind of post-hypnotic suggestion for relaxation or for comfort is you might hear something like, or craft this on your own if you're using self-hypnosis, at the first sign of the problem, of the symptom, at the first sign of some discomfort, some itching, it will automatically occur to you to take a few deep breaths, to take your imagination vacation to that special place that you love to go to, or it could be you'll automatically remember to imagine how wonderful it feels to pet your dog or to take a walk out in your garden, whatever it is that you know is a good experience, and you will begin to feel better. So that's again where these suggestions are really helpful, and it highlights a bit the distinction with mindfulness, which is more about refocusing your attention. So specific kind of tips and skills that I work with hypnotically to help people manage and feel better is the imagery, is perhaps changing the color, size, or shape of someone's discomfort, because our imaginations are great and we can actually start to think of the discomfort as an object and then make some changes in it. To use that special place imagery, which is a pretty quick and simple way to get into or become involved in an imaginative experience that's a hypnotic trance. It's essentially, where would you rather be right now? Right? If I were to say that to all of you, where would you rather be? Spend some time imagining that. That would be the beginning of a hypnotic experience. And then within that hypnotic experience, how to turn off or change parts of our body and how it's functioning so that we feel more comfort. I'm going to skip these a little bit because I want to make sure that we can do an experiential piece, and then I'm interested in hearing from everyone. So again, the mind, body, skin paradigm or model, I was talking largely about hypnosis, and now we're switching a little bit more to that mindfulness that I've been referencing. And mindfulness, as I said, is paying attention in a particular way on purpose in the present moment and non-judgmentally. It's been associated with improvements in all of these areas. There's been quite a robust research base now on the impact of mindfulness. And I'm including a couple of kind of scripts of how to get going on mindfulness. But what I would really love to do is to guide everyone here in a little mindfulness activity, if that's all right with you. And I'm hoping that is. All right. So I invite everyone to get comfortable in their seat, in their chair. Perhaps put your feet flat on the floor if you can, because that will allow you to then raise your body a little bit and elongate that space where the breath is going. And it can be helpful to imagine a string tied to the top of your head, gently tugging you up so that there's really a nice long body for that breath. And as you adjust and get comfortable in your chair, simply begin to notice the cool air at the tip of your nose as you take a breath in, and it begins to flow on down through your body into that well, bringing wellness to you. And then you breathe out through your mouth, exhaling and releasing all that you no longer need. And there's no need to change anything. Simply notice the breath going in through your nose, 2, 3, and out through your mouth, 3, 2, and 1. And as you focus on your breathing and this cycle, you may occasionally find your thoughts begin to wander, as is natural and normal. And without criticism or judgment, should that happen, simply invite your attention back to the next breath in that you take. Noticing again the cool air at the tip of your nose as the flow goes down through your body and travels to all the places that need this breath. And you exhale and release out any tension, tightness, anything that you no longer need. That's right. And perhaps, should interfering or distracting thoughts pop in again, you can almost imagine them as small air bubbles hopping up through the water of your consciousness. And when they reach the surface, those thoughts can simply disappear and float on off as you again notice the next breath in, 2, 3, and the breath out, 3, 2, and 1. So I'm going to just give you a brief moment to readjust and alert after this, and we'll continue on with this so that we can get to a couple more slides in the Q&A. But I hope that that gave you a taste of the mindfulness and how to focus your attention and refocus it back to the current moment, because that's really where the growth, the magic moment is that pivot back from being distracted by something that in your mind's eye to what you've set your intention to. There are also many, many ways to change your breathing patterns, which we know are very, very effective, because breathing is really the swinging door between our inner and outer world. And here's a quick kind of how-to about mindfulness for stress management. And it contains the key elements that I was using just a moment ago to focus our attention. There's a YouTube demonstration of mindfulness being a clearer perspective. And in fact, the snow globe is an image that I love to use because it is such a dramatic and vivid way to see and remember cool, cold, pleasant, refreshing, bracing moments in nature. And so there's kind of the double advantage of it's a way to think about when the snow stops floating down, that's when our mind has cleared. But because it's about snow in a snow globe, it's also about something cooling, which is very effective for producing comfort when eczema is bothering us. I'm going to finish off by talking about one additional hypnotic tool that I've been using more and more lately, which is called the Magic Glove Protocol. Here are a couple of links to, or a link to a YouTube video demonstration of it by Dr. Leora Kuttner, who's a psychologist who developed this and taught it to me and others, and I'm now teaching it to healthcare professionals and parents. And it's a really, really fun and effective way to introduce numbness or some analgesic experience when a person is going to have an injection or a procedure done. So it's for pain management. And I've begun to adapt it and introduce it to people because I'm understanding that often, or more and more, there are treatments which include at-home injections of biologics. So the Magic Glove protocol is shown to make the skin numb on the back of the hand, and then that can be transferred to another part of the body where the injection is going to take place. So it can be transferred to the thigh, it could be transferred to the stomach, it can be transferred so that there's a more comfortable setup for an injection. And if I'd love to hear what people's thoughts are, if this is an area that is of interest to them, or if they are now finding that their treatment plan includes injections like this, because I think that it's an invaluable tool. With that, I wanted to get to a point where we could have a conversation, and I'll turn off all the slide stuff and am interested in any questions or comments.
Thank you so much. That was fantastic. And I always appreciate when we get to do a little bit of the practical too. It's so
Good,
nice.
good.
I'd love to open it up. If anybody has questions or comments, how did they feel? We have a few minutes left, about 15 minutes.
And I'm trying to get my slide share off. That's all that I'm trying to do right now. I don't know if I've done that properly or not.
It's still up. I'm not sure if I can turn it off. Let me see. If you just hit like escape on your keyboard, what would happen?
We'll find out. Oh, here we go. There, stop share came up. Finally. Thank you. Good. Yeah, I'd love to hear, certainly a first beginning point is the experience. How was that for people? And was there anything that you were surprised by? What worked, what didn't work?
Well, I hate that I have to know all this stuff. And because it's just better to go about life and be able to ignore itches and all that kind of thing. I loved your slide about reduce the stress of external challenges.
Ah,
And all I can think about is that I started as a little kid with eczema. And, you know, what do you like to do? What do you want to be? I'm going to be an artist when I grow up. And everybody went along with it. And all of that, the questions come when there's no time to do work because you spend all your time doing all those things that are more important more important than like a job. Like when your skin and your mental health, and then you have to go to school and all of those things.
yeah.
It's like, deal with your stresses. I discounted that whole stress thing my whole life because it's like, stop, everybody's got stress. You know, this is what we do. But at the same time, I put up very firm boundaries about things that I wouldn't do. Yeah, no, you can't ride in my car with your perfume. I mean, and that's much later. Oh, you know, you could hold my hand. This isn't contagious. Oh, you think it looks bad? Well, imagine living with it. Like, you know,
Right.
just anyway,
No,
it was a beautiful slide.
oh, good. Well, thank you for
I
that feedback, and I
appreciate
appreciate.
I appreciate that all of this stuff is being looked at. Like when I was little, it was, you just got to, you know, hang on, honey, you can do it. And I had great parents who, you know, didn't tell me not to scratch and didn't, you know, and here's, use this little bit of thing and use that. And, you know, so
Yeah.
I grew up really liking who I was, but fighting for it all the time.
Right, right. There was something extra that you had to do. I think that's what you're saying in terms of it, which cut into your time to do other things. It was always somewhere on your mind. And I think that that's a good description of what chronic stress and a chronic condition is. Thank you.
Please feel free to unmute and turn on your video if you wouldn't mind. I see the hand up.
Hi, my name's Hiba. Sorry, don't feel very presentable right now, so I won't turn on my video just yet. But I'm just wondering, in terms of acupuncture or acupressure, I found that's been very effective for me in terms of bringing down my stress level, like almost kind of immediately. And I don't know if that overlaps or is connected in any way to hypnosis or mindfulness, or is that just like in its own category?
Yeah. And I am not trained in that, but I believe Dr. Leo is. And certainly I do know that it's another excellent tool.
Yes, I mean, I definitely find that acupuncture and acupressure, they're doing a bunch of things, right? There's no doubt that there's really something to the needles or the pressure. I really think that there are measurable changes. And in fact, some studies have even compared doing a real acupuncture point compared to a pretend one. So you kind of get all the other aspects and you really still can show a difference. But that being said, I still think part of the benefit is being in a quiet space with a practitioner who's kind and gentle, who's touching your skin very gently. There's a peaceful period where you're kind of getting in touch with your body. And I feel like that's certainly part of the healing, right? Compared to going to a regular doctor's office where you're shoved in a waiting room and everybody's yelling and there's all this noise, and then you get brought back and you only have a few minutes and they're just pinging you with questions and what update the thing and which pharmacy, so it's so different, that whole experience. And I feel like that is important. We can't deny that. But even home stuff, I have patients find this point here called large intestine 11, kind of on the outer arm, and you can do a gentle massage there, and that really has been shown to help a little bit with itch. It's obviously not the most, going to change everybody's world, but for a lot of my patients, I say, you know what, I do that massage, and then I realized when we did our study of that point, we had a really good response. And then later did I learn about habit reversal therapy, which is sort of I guess, kind of a cognitive behavioral therapy concept where instead of telling people stop scratching, which we know is just bad, it doesn't help and it makes people feel crummy, you can give a replacement behavior suggestion. And so people will sometimes say, like, tap your fingers or gently rub or, play with some worry beads. And it turns out this is probably doing some of that too. It's something, instead of scratching when you want to scratch, you can just gently massage a point. And I like that it's kind of a 2-for-1. There's a behavioral replacement piece that's habit reversal, but you also are potentially doing something energetically with our body, doing that acupressure point. So I thought that was kind of cool.
Thank you. That is cool. And I'm jumping on that. I can't wait to make sure I add that. You're right. It's the habit reversal, tapping, or even a child. You could give a child a piece of Velcro to rub instead of their skin. So people get creative with that.
Thank you very much. That was great. Thank
Thank
you.
you, Hiba.
Ooh, Velcro. That sounds like a good itch tool now that I'm thinking about it. Gently, gently.
I'm going to put in the chat too for those who are interested. I'll put a link to our little handout on habit reversal therapy, and
Okay.
it's kind of a neat thing to flip through. It's very short. It's just a pamphlet, but it has some information about it and how people might use it. It's kind of a nice little handout.
Nice, nice.
Other questions or comments or
Another,
thoughts?
um, uh, to extend the conversation on habit reversal, there's another hypnotically based technique, which is to suggest that one hand is the helper hand. So when one hand wants to scratch, the helper hand will come along and move that scratching hand down or away. And then you can, you could introduce doing something else with the hands entirely. But again, it's not being stop scratching or don't you shouldn't scratch anymore. Listen to the language of saying, here's a helper hand, which is going to move that hand away. So um, I didn't mention specifically the summer months, but I know in terms of some of the clinical conversations I've had in the last several weeks, right? The heat is really difficult. What do I wear when I go out? Or do I stay at home and because I can't put any clothes on? Things like that which are related to eczema and just how uncomfortable it can be in the heat. Is that anything that people have things to add to?
And it's been a bad summer. I've had more patients than usual telling me that I think the heat and
Yeah,
humidity
exactly.
really have been driving them crazy. And we think that part of it is sweat is an irritant. So if we're getting sweaty, part of it I think is literally just the heat. Part of it is that the microbiome changes, that there's more yeast development on our skin. So there's all these little things that can drive it. And we know it's often not, I always say we're never lucky enough to have just one simple thing. It's kind of like this delicate balance, precarious balance. So it's like
Mhm.
maybe you're holding your own, and then it's like, well, the heat, the humidity, the yeast overgrowth, and now it takes very little. So then it's like, what triggered it? It's like, well, it's probably a few things.
Yeah,
It
it
could be
was
anything.
right. Oh gosh. Yep.
I always say it's like if you wake up in a really good mood and you're kind of happy and chipper, somebody could even be a jerk to you and you'd be like, all right, I'm sorry you're having a bad day, but I'm going to go about a great day. But if you wake up in a bad mood, right?
Yeah.
Even somebody wishing you a good day, you're like, sure, be quiet, you're loud. It's like, I
Mhm.
feel like our skin is the same way. If it's really unhappy, then it can be almost nothing to trigger. But if it's in a good place, then it has that resilience. And even something, even sitting in the car with somebody with fragrance or perfume, you might be like, all right, I can get through this, maybe. Well, if there's any other questions, I'll give a few more minutes and maybe we'll wrap up just a couple of minutes early. I will post this video. And Dr. Lombard, do you want to put your contact information in the chat in case people would like to reach out to you? And of course, I'll put it on the website as well when we post it.
Absolutely will do.
But
I have a really quick question, if it's okay. Is there any connection to temperature or climate when it comes to I mean, I guess it's all kind of related, right? But I found, like, for example, I attended the Eczema Expo and I visited some family in Texas right afterwards. And the temperature, the climate there is like super hot, you sweat like crazy. And I noticed a significant like improvement to my skin. And I don't know, maybe this is not really related to hypnosis, but I was just shocked. I was sweating buckets. It was crazy hot, but and there was like a really big difference too, especially on my face, maybe not so much on my arms. But yeah, I don't know. I don't know how maybe this relates to this conversation, but I know we were talking about environment just now and stuff too.
it's interesting because I've had many families over the years, they've told me when they go on vacation, it gets better. And that's interesting because there's a lot of changes happening. Now, some people have a big flare up on vacation. So that's the other side of this whole coin, right? Some people are miserable. They hate being in the plane. That irritates them. They go to a hotel and they're miserable. So that's a separate piece. But many patients will say, I'm better on vacation. And I've actually had a handful of patients and families move to their vacation destination, Florida or wherever it is, and then a couple of them have come back, which is fascinating. And I'm like, well, wait, I thought you guys moved. And they're like, well, we moved and everything was great for the first few weeks, just like vacation. But after we got settled, it
Mhm.
went back to what it was doing in wherever we were before, Boston or Chicago. And
Yeah.
I'm like, huh. So I think part of it is when there's a big disruption in diet, lifestyle, patterns, sleep, you can sort of shock your system and you'll see this improvement. I think that's why a lot of times people do something dramatic and they'll say, I think it was helping a little bit at first, but then the body sort of gets wise to it and says, yeah, no, we can catch up. So it's important to look at that a little bit more longitudinally. And that's true for any treatments, including ones I give. Sometimes people say, boy, after the first shot of the medicine, doc, I was brand new. And I'm always a little bit skeptical. I'm like, okay, I'm glad, but let's see how we do over time because that's good. But there's often a lot of things happening in that moment. And right, in climates, people say, "Oh, I wish I could live in Florida. Nobody must have eczema in Florida." And then you go to Florida, and then people are like, "I hate it, the humidity and heat." And then people say, "I wish I could live in Colorado where it's super dry." And the people in Colorado have eczema say, "Oh, it's so terrible. We never get any humidity, and it's so raw." So I think it is very
Yeah.
person dependent, and probably some people could find a better climate for them. I think that is a real thing. But others, once they get settled, their eczema kind of finds its own things that bug it.
That's fascinating. Thank you for that. Because I was convinced I should be moving from Toronto, Canada to like Dallas, Texas. I need more
You could
climate.
try it, and then let us know.
Yeah, let us know. And I think you really described something that is really interesting. And also, by definition, if it's a true vacation, you're moving away, you're going away from your normal routine, which has some stressors that perhaps you're not even aware of, and you allow yourself to relax a little bit in a different way, and that may turn down some things for a while, thinking about psychologically how that's happening. But then if you were to move, the same routine happens. Life continues in a different location, and that can still be tough. Yeah,
Well, completely. Thank you. Thank you very much.
sure.
Thank you everyone so much. I'll wrap up here and I'll put the contact information up on our website as well, chicagoeczema.com. And stay tuned for the next one. It's going to be September 14th, I think.
Right. Well, thank you all for sharing your time with me and helping me to better understand things. And I hope this has been useful. Thanks. Thank you, Dr. Leo, too.
Thank you, Lisa, so much. See you guys soon. Bye,
All right.
everybody.
Wonderful. Bye-bye.